If you can't go out, go within. Namaste friends. I am Ritesh and today we will cover Yoga Neck Alignment Part 1. We have already covered foot alignment, knee alignment, hip alignment. The links are given above. Yoga can relieve neck pain or it can be the cause of neck pain. Friends, necks are an amazing piece of engineering. They are mobile, yet they support the head in a range of movements. Do you know how to protect your student's neck? Hear what every yoga teacher or practitioner should know about neck or cervical spine. Asanas with neck hyperextension. Friends, if you normally see some of the asanas, we hyperextend the neck. Asanas that require extra care to avoid neck pain are asanas such as Urdhva Mukha Svanasana, that is also known as upward facing dog. Chaturanga Dandasana, that is a four-limbed staff pose, and Bhujangasana, that is cobra pose. People's head are thrown back, their neck move or hyperextend. Matsyasana, that is fish pose. Halasana, that is your plow pose. Sarvangasana, that is your shoulder stand. Trikonasana, that is your triangle pose. And Urdhva Hastasana. So friends, even Paschimottanasana, the head goes back. And there are plenty of steps you can take to make sure you're practicing yoga in a manner that is safe, effective, and appropriate for your body, ability, and desired results. Why should we avoid hyperextension of neck? Not only does a hyperextended neck in any yoga pose can cause neck discomfort, but it misaligns the hyoid bone in a position that deactivates the abdominal muscles and also might cause mental agitation. It also stops the blood circulation to the brain, as the back of the neck has vertebral arteries that distributes the blood throughout the brain. If blocked, it can cause dizziness or even a temporary loss of consciousness, which can lead to a fall or possible injuries from the impact. And that is also the reason I do not recommend the neck rolls, as sometimes neck rolls can be great for calming stressed students but not safe for everyone. But yes, I do recommend Brahma Mudra of Kaivalyadham Yoga Institute. It's safe but not neck rolls. What is a hyoid bone and how does that connect to my abdominal muscles? So the work of the hyoid muscle bones help to open and close our jaws. But current studies show that they also help in aligning the neck, activating the abdominal muscles, and also helps to relax the shoulder blades. But whenever the head is pulled forward, the hyoid bone is misaligned and it deactivates the abdominal muscles. When you swallow, the hyoid bone lifts up, lightly stimulating your digestive tract. Your abdominal muscles also respond slightly, toning, drawing in and up at the lower abdominals. Indeed, it feels natural to pull your lower belly in when you swallow. If you doubt it, just try swallowing while pushing your lower belly out. Strong hyoid muscles result in a graceful, uplifted posture. But modern living does not lend itself to strong hyoid muscles. If you wish to go more deeper in what hyoid bone alignment is all about, then I would recommend you to read this book, by Tom Nagel's book Zen and Horseback Riding. Let's take two examples of the movement of the neck. Neck flexion with bend in the cervical spine and neck flexion with cervical spine straight. When hyoid bone drops down and forward, your chin juts out and your neck and upper back responds by collapsing and curving forward. Neck alignment is given importance not only in yoga but stock Pilates and even in horse riding. So friends, it's an universal alignment to always check your neck. In anatomical terms, it's also known as craniovertebral flexion. When we carry ourselves with the head thrust forward, we create neck pain, shoulder tension, and even disc herniation and lower back problems. The neck should hold its natural curve with the skull balancing directly above the shoulders, while to the seated, standing or lying down positions or poses. While in supine positions, that is lying down on your back, if the vision is towards the back, or also known as kyphosis or forward head posture, pads or pillows under the head may be necessary to support the head and prevent overextension and unnecessary tension in the cervical spine. In most instances, the cervical spine should continue the line created by the thoracic spine in neutral or during flexion, extension, lateral flexion, and rotation. Cervical flexion should begin with a slight head nod, referred to as a craniovertebral flexion. Avoid jamming the chin into the chest. There should be enough room between the chin and the chest to fit a small fist. So, friends, when we practice our asanas, it's important to be aware of our neck positions because that can affect the whole body posture. In my next video, we will cover some asanas and check anatomically what difference does it makes when we hyperextend the neck or when we keep the neck neutral. Let us find out when to do a neck roll and when not. When should we try hyperextension and when we should avoid it. Hope this information was quite helpful. Thank you for watching my video and do not forget to watch the other alignment videos. Take care. God bless. Keep smiling. Namaste.